Start. For those of you in the audience who don't know very much about the Women's Club of Roland Park, we've been here, been a club since 1896, and the clubhouse, the ladies who founded it bought this land, or were actually given this land, but they built the clubhouse themselves. And the clubhouse is from 1904 through the 30s, and it served us well for this many years. And if any of you are interested in finding out more, we do have some people from membership who have some applications that are in the table right in the back of this room. And I know they'd be happy to talk to you and ask any questions. We have not just daytime activities, but we have evening activities, so there's kind of something for everybody. I was asked to show you your token. Those of you who are eating lunch should have one of these, so please take it with you upstairs. If for some reason you don't have it, you can talk to Janet Lee Kayla, who's out at the table out in the lobby. We are having, next week is our last week for the season, but we have a very special day planned. We have the new president of Towson University speaking to us at 11, and then at 1:15 we are going to have a beautiful concert of Broadway show tunes performed live here. And afterwards we're going to have a third Thursday sort of end of season party. So I hope you all can come. And lastly, we have a trip to Chanticleer Gardens in Pennsylvania. I think we may have a couple more seats. It's close to being sold out, but if you're interested, see Carol Brandt. So that's it for club business, and I'm going to introduce Ann Perry.
Thank you. I am delighted to see so many people here. I hope we have lots of neighbors as well, lots of new people who are coming. This is the first time the club has ever done an event like this, as Steve has told many of you, and we just wanted to do it as kind of a community service because, you know, we're all getting older, and this is something that we should all learn about, just in case. I also want to welcome all of you who are visiting. And I wanted to put in a plug. I'm a relatively new member here at Women's Club, and I can't tell you how much I've enjoyed being here for about a year and a half, almost 2 years. And the programming is wonderful. There's always something interesting. So this was our weekly Thursday programming today, and you all are part of that, and I thank you for coming. I want to put in a plug for Steve Gurney, who is the publisher of this magazine. They're back on the table there, and I hope that every one of you will take one when you go. It's just the Bible of the elder care industry. It covers Northern Virginia, DC, and Maryland. It tells you every place, every sort of service that's available in all of those areas for elderly people. Housing, moving coordinators, elder care attorneys, home care, anything you're looking for. It's paid for by the advertiser, so it's free of charge. So if you want another copy or 16 more for your friends, you can just go online and order them or make the telephone call. Steve is an old friend. I used to be in this industry, and I've known him for like 30 years, and he does a podcast, and he just knows everybody that's in this business. And he's the one that's really responsible for setting this up today. And I can't thank him enough for bringing in all of these wonderful vendors. And I thank you for coming as well and helping us to have this program today. I hope you all enjoy it, and I'd like to introduce Steve Gurney.
All right. Well, thank you so much, Ann. And I've really enjoyed working with the Women's Club and putting this together. And I'm really excited today to introduce you to a lot of people and resources that can help you all, that can help your neighbors, that can help your family members. Talk about a topic that can sometimes be rather difficult. I put my application in for membership, and I'm hoping that it's approved. But let me quickly go through what we're going to do today, and then I am really excited to introduce our keynote speaker, Dr. Chiaramonte. But so first off, here's our agenda. You all got here just fine. I can't believe it wasn't raining this morning. Everybody, let's do the anti-rain dance. And we're going to have a wonderful presentation from Dr. Chiaramonte next. Then we're going to go upstairs for lunch. We have other vendors up there. We're going to encourage our vendors to have conversations. I've got a mic up there, and so we may sort of have a little bit of dialogue. We'll see what happens. Keep a flexible point of view on today's event. And then in the afternoon, we're going to do a really cool panel presentation where we are going to talk about purposeful living. We're going to talk about anything and everything related to aging and longevity. We're going to start with purposeful living, the challenges of planning ahead versus a crisis. And then we're going to break the discussion down into 3 primary buckets: aging in place and all the things that you can do to support aging in place and aging in community. Then we're going to talk about making a move and what are the different types of options for where we can live. And then last but not least, we're going to talk about all the resources that are out there that can help you, because you don't need to walk this road alone. There are so many supportive organizations and individuals, and each other in this room we can help each other. Okay, and then I really want to recognize the featured providers that have supported this event and that are here today. Make sure that you engage with them. They are tremendous resources. If and talk about to our vendors about the questions that you have, because even if they're not directly providing you with support, I guarantee every one of these folks in the room knows 5 or 6 people that might be a solution for you. And you'll get to meet them all in the afternoon session, and all of them are going to share one tip. So you're going to walk away today with about 15 tips and suggestions that you can share with your friends, family, and loved ones. And I think that is it on this count. So now I am delighted to have the honor to introduce our keynote speaker. She is a native Baltimorean. I think, is that how we say it? Okay, good. Thank you. I didn't botch that. I'm going to pray that I'm not botching her name. It's Dr. Delia Chiaramonte. I knew I was going to do that. And she's got a brand new book, which you can get right over here. It's called Coping Courageously. But my endorsement of Dr. Chiaramonte is, I had her on our Positive Aging Discussion podcast a few weeks ago, and as she started talking, you could see in the chat, people were like, how can she become my doctor? Is she accepting patients? I mean, honestly, when you leave here today, you are going to be like, why is every doctor not like Dr. Chiaramonte? And that speaks to our screwed up healthcare system, which I'm sure she could talk the whole hour about. But without further ado, let's welcome Dr. Chiaramonte.
Thank you so much for that amazing introduction. It's so nice to be here. I'm so happy to see all of these people here too. So I'm Delia Chiaramonte. I am a physician. I've been on faculty at the University of Maryland for 15 years. I was division chief of integrative palliative medicine for Gilchrist GBMC until not too long ago. And all of that work that I did made me see the importance of focusing on caregivers. For as messed up as our healthcare system is, there are a lot of resources for patients. There are not a lot of resources, not as many, although the ones that exist are here today, for caregivers and helping people cope themselves. So I'm focusing now on helping caregivers, which is why I wrote the book and why I want to talk to all of you today. So I want to tell you first about, we'll call him Joseph, and his terrible hospital stay. So this was a patient of mine, and his journey started when he fell. He had been a completely functional person, doing great, living his life, and then unfortunately he fell and he broke his leg. And what happened next tortured his wife and took him down a path that was really terrifying and unnecessary. So here's what happened. He broke his leg, he went to the emergency room, as you would. He was there alone, unfortunately, because it was during COVID, so there wasn't somebody to advocate for him. He was yelling in pain. They gave him a ton of pain meds. And then, any idea what happened once he got a ton of pain meds? He got confused, right? He got so confused, which happens to people who end up in the hospital and get a ton of opiate pain meds. And so then he ended up on the floor with a young doctor, and that doctor called the wife and said, "Your husband has dementia. We're going to do surgery, but maybe you don't want to do surgery. Should we call hospice because he has such severe dementia?" And she said, "Dementia? No one ever told me he had dementia." And in fact, a week ago, he was doing the New York Times crossword puzzle and completing it. So does he have dementia? No. How come you all know that? And the young doctor didn't know that? Because sometimes, quote, doctors are student doctors. This is a trick. In many hospitals, if they have a short white coat, they're a student. If they have a longer white coat to the knees, they're a resident, more advanced, or an attending. That's the gray-haired doctors. So this student didn't know. They just saw a guy of, I think he was in his 80s, confused, assumed he had dementia. But his wife was suffering because she didn't know. The doctor just told her that her loved one had dementia. And she was like, "Oh my God, I remember my neighbor and her husband had dementia and how awful and tough that was." But the thing is, you all know he doesn't have dementia. He had something called delirium, which looks just like dementia, but is acute. It happens all of a sudden and is often temporary. And so it's a hugely important difference, but the young doctor didn't know that. The wife didn't know that, and so there was a ton of suffering that happened in that family only because of a lack of education and knowledge. And part of why that happens, I think, is we don't talk about aging and how to do it well and how to manage illness and advanced illness. We don't talk about it enough, so when people find themselves in that situation, they don't have years' worth of skill. All of a sudden, they're learning in an emergency. So the thing that palliative care is focused on, and I'm going to say right now, if you think that palliative care is end-of-life care, you're not alone. Even doctors think that, but it's wrong. Palliative care is just the reduction of suffering in people with serious illness, and that means emotional suffering, physical suffering, existential or spiritual suffering, like I'm afraid to die, has my life been meaningful, those kinds of things. So the whole focus is reducing suffering. There are other doctors who are trying to reduce the illness. So if you have cancer, for example, your oncologist is really focused on, let's get rid of cancer. But the palliative care doctor, even if you're trying to be cured, is focusing on, are you nauseous from chemo? Are you fatigued? Are you anxious? Are you depressed? Are you scared? Is your family in crisis and chaos? Can you sleep? Can we reduce the physical, emotional, or existential, spiritual suffering in your family? So that is crucially important. And this is my soapbox, I'm sticking to it. It's as important as working on the illness, because we are not illness. We are humans, we are people. And yes, I'm glad there are oncologists and other doctors who work on illness, but that's not the whole story. We need to be taking care of people, and not just people, but families, because illness and aging does not happen to one person. It happens in the community of whoever you call family. So it could be your blood family, it could be adopted family, it could be your neighbors, it could be your best friend. It's whoever you think is part of your world that's important. Illness affects everybody, and reducing suffering in all those people is crucial. So did his wife suffer? Yeah. She was so afraid, she was frustrated, she was furious at the doctors. She felt guilty that he had dementia, I didn't even know. So he didn't have dementia, but she thought so because that's what the doctor said. She felt guilty that he was suffering and she couldn't help him. She had physical change. So when you're really stressed out, do you notice something in your body? Yeah, right? So you can get headaches, you can get jaw pain, you can hunch up your shoulders and get neck pain. Sometimes you can't sleep, sometimes you have chest pain or palpitations. So stress affects our physical body, not just our emotions. And she was terrified because she couldn't imagine life without her beloved husband. And there was a huge knowledge deficit, which would have been easy to fix, which is the difference between dementia and delirium. So this is another patient. It was the caregiver that I was helping, and her mom had had dementia for 8 years. And the biggest stress in this family, I don't know if you've ever seen this before, but siblings were not working great together. Has anybody experienced that? Yes, right. Yeah. Because here's the thing. When a family has to make decisions for someone else in the family, for a parent or someone else in the family, everybody's worst qualities magnify by 10, right? And somehow you're supposed to work together to figure out something that you don't know how to figure out, you've never had to do before, and boy, are your siblings annoying and not acting as they should, right? So all of the old stuff, all of the personality quirks escalate, and it makes it harder to work together on a difficult plan. So, which is why I have a whole section of the book actually focused exactly on how on earth do you do that, because you can't make your siblings be different than they are, but there really are practical things that you can do to work with your quirks, because you have them too, and their quirks to make decision-making easier. But that was the thing that was really stressing out this family, is they had to make decisions for mom. They could not work together. Everybody was exhausted and mad and guilty, and the whole family kind of was in crisis. So here's one of the things that I noticed when I was in practice, which is that even with the same condition, some families fell apart. They're fighting, they're not talking to each other, they can't sleep, there's chaos, there's drama. And then other families with the same illness, of course they were sad, of course they were stressed, but they came together closer instead of getting farther apart. And so it really struck me, what is it that those families are doing? And if you teach those skills to the first families, can you help them suffer less? Can you help them cope with these difficult situations better? And of course, because I'm up here, it does, you can, it works. So there are specific things that the families who were doing well did, that when I started teaching them to the other families who were struggling, their stress went down, their connection with each other went up, their sleep was better, their stress was less. And so that's what I think is really important to know, because it's easy to think, well, sure, it's a mess, mom has blank. That's why we all feel so terrible. But the truth is, yes, mom has blank, and it's hard, but it doesn't have to be as terrible as it may be. And there are things, specific things that you can do to make it less so. So we're going to talk about some of those things today. So this is not news to anybody. Being a caregiver is hard. Why is it hard? It's hard for a lot of reasons. I think partly it's hard because we're just not trained. We don't talk about it as early as we should talk about it. And the other reason that it's hard is that we are often conflicted, right? Like, maybe nobody here has ever felt this, but if you say that, you're probably fibbing. If you've ever had to take care of somebody who's ill or significantly aging and declining, there are moments where you feel like, I don't want to, right? I don't want to do this anymore. This is too much. I can't. But nobody tells anybody else that they ever feel that way. So it's a secret. It's hidden. And people feel terribly guilty, like, I love mom, I love dad. Why on earth would I have this thought that I don't want to do this right now? I'm tired, I can't do it anymore. But this is just normal. So normalizing that, yeah, it's hard, and you're going to have times where you're doing better, and you're going to have times when it's harder, and you'll even have times where you just don't want to do it, and that's fine. Doesn't mean you're not a wonderful, loving person, or a wonderful, loving child, or sibling, or parent. It's normal. So part of why it's hard is that we don't normalize these complicated feelings. We put on a happy face and pretend it's all great, but the fact is, it can be great and tough at the same time. And holding space for two different states of being is really important. It can be hard and meaningful at the same time. It doesn't have to not be hard if you want it to be meaningful. It's hard and it's meaningful at the same time. That's one of the few things I really want you to leave here with. is hold out both hands and make space for two states of being. I can be angry at you and love you at the same time. I can be happy and sad at the same time. I can be joyful and exhausted at the same time. Hold space for two different ways of being. So we talked just a little bit about this. How does stress impact you? All kinds of ways. And so the reason I put this up is I want you to think for yourself. Sometimes stress, doesn't come out that way. It comes out as, I can't sleep. I don't know why I can't sleep. Or because I haven't been sleeping, I'm so exhausted. Or I have headaches. My headaches came back. I have migraines, right? So, maybe it's migraines, which are a certain kind of headache, or maybe it's that this is a really stressful time. So checking in with your body is a way to see, is the stress impacting you? Because sometimes we're so tough, we hold it together, we're like, no, I'm good, I'm fine. But I'm exhausted, I don't sleep, and my head hurts all the time. Right? So listen to your body. Listen to your body, because if we just white knuckle it all the time, we don't get the opportunity to actually reduce our own suffering. And so we're going to talk about some specific things that you could do in a little bit. Actually, let me say one more thing. This happened often in my practice. I would ask one of the, let's say it's a married couple, and say, is that one feeling particularly stressed out or anxious or depressed? And the person themselves would say no. And what was the spouse doing? So sometimes it's grumpiness. I'm not stressed, you're just irritating me, right? So if somebody in the family is suddenly more grumpy than they were before, just remember that that's sometimes a sign of being overwhelmed or stressed by the situation that they're in. So besides the obvious, the other things that are tough about caregiving are sometimes the conversations. There are tough conversations that really should be had. And we have a funny approach to illness and mortality in this country. We're afraid to say the D word. So I just want to say it right now. Saying death does not make people die, right? So, think of that. Sometimes we're like, oh my God, like it's magic, dark magic, I can't say it. Let's just talk about things. Let's just shine a light on the things, right? Let's just be open, talk about them. Terrible things don't happen from talking about them. More terrible things happen from not talking about them. And that last bullet, anybody have any boundaries in the room? No, right? That's a tough one. Here's the thing about boundaries. So remember, we're going to hold space for two different things at the same time, right? You can be loving and totally devoted to caring for someone that you love and set boundaries at the same time. And so what do I mean by setting boundaries? I mean things like, I need to go home and have a good night's sleep. So I'm going to get somebody from my religious community, come stay with my parent, or I'm going to hire somebody. I can't do this all by myself. Or even, I shouldn't have said that. I don't need to do this all by myself. I deserve well-being too. I need to be able to get a good night's sleep. I need to go home and take a shower. I need to take a weekend off. There are so many ways that you can access support, including all of the people in this room and upstairs. And here's what a lot of people do instead. They hang on by their fingernails. I got it. I'm okay. I can do it. I don't need help. As though you're supposed to be yourself on death's door before you reach out for help. And I'm really going to encourage you that if you or someone you love now or in the future is in this circumstance of helping someone who's ill or aging and declining, get more help than you think you need and get it sooner than you think you need it. Because you deserve it. And here's the other thing. Remember, we talked about stress causes grumpiness, right? So if you're stressed out, are you your most happy, pleasant self? No. And you know who that's going to negatively impact? Yeah, the patient, your loved one. So if you're like, no, I don't need any help, I've got it, I can do it all by myself, and you're cranky to your mom or your dad or your sibling or your child, that's not great for them. Because you know what they don't want? A cranky caregiver. They don't. They want you to be happier because then you're more empathetic. When we're stressed out, we don't have access to our empathy in the same way. So setting boundaries means realizing, like, I'm totally fine being there all day Saturday, but I need to take Sundays off because that's me. Another person might say, I can be there Saturday and Sunday, but I can't work a whole day and then go over. I need evenings during the week off. So checking in with yourself, what do you need to still feel well, to not have tremendous stress, and setting that boundary and then getting help for the other parts, because you can be loving and set boundaries at the same time, right? Setting boundaries does not mean now you're not as good a daughter, now you're not as good a son, now you're not as good a sibling. You can be loving, completely committed, and set boundaries at the exact same time, and I would really encourage you to do that. It is the better way. You'll be a nicer caregiver. It's better for your loved one. So there's all kinds of evidence for how difficult caregiving is. This is no surprise to anybody who's been a caregiver. But in medical science, when they do stress research, there are two groups of people that they use for stress research because they are so stressed. The first one is medical students before exams, and the second one is caregivers. Exactly right. So medical scientists know that when you're looking for a population of stressed out people, caregivers is the place to go. So that should tell you something, right? That should tell you something. Setting boundaries, doing some of the things we're going to talk about in a minute for your own well-being so that you can show up as a happy, loving, empathetic, wonderful, connected caregiver because you've set some boundaries and got some help. Now, when you're burnt out and you're exhausted, here are some of the things you don't do a great job of. Having really challenging conversations, because it takes some oomph to do that, right? Like if you're at the end of your rope, oh my God, I can barely cope anymore. Is that the time that you're going to have a really deep conversation about goals of care and end-of-life wishes and what's important to your loved one? No. You're going to be like, look, I made dinner, we're going to eat dinner, I'm going to clean up, and then I'm going to bed. Right? You have to be in kind of a filled up space to engage in the important, courageous conversations that really need to be happening if somebody in the family is declining from aging or illness. I, as a palliative care doctor, I think it is so crucially important that everybody have these conversations with their loved ones about what they would want if their illness advances or if they decline significantly, because there comes a time where we can't speak for ourselves, and you want to have put out there what you want so that you continue to speak for yourself. I was just telling somebody in the room that my younger daughter took a medical ethics class in a university that had like 200 kids in this class, and the instructor said, who here, raise your hand if you have an advance directive? These are a bunch of 20-year-olds. She was the only one. Both my kids, who are in their 20s, have advance directives because, look, they drive cars, right? Stuff happens. You never know. And it's so important for our own sense of self to decide, who are we? What is really important to us? And let me put that out there in case I ever can't speak for myself. So for me, for example, I have an advance directive, as you might imagine, and so does my husband. And it says in there some handwritten stuff like, as long as I still recognize people, and I can have a conversation, connect with them in some way, I still want aggressive care. But if there comes a point where I don't recognize anybody, I'm not waking up, and the doctors think I never will, because of what's important to me is connection with people, then I don't need aggressive care, because that's about me. So it's not about like, do you want intubation or not? It's about who are you and what matters to you. And when you talk about this with your family members, then they know how best to serve you. And when you write it down and sign the paper, then your doctors know how best to serve you. So these are really important components of caregiving, which is why you have to be filled up and well so that you'll engage in these things. Because if you're too wiped out, you'll be like, oh, we'll talk about it next weekend. And it never comes, right? Many, many people it's heartbreaking, seen it so many times, people in the intensive care unit. And we ask the family members, well, what would she have wanted? And you know what they say often? We never talked about it. We never talked about it. And this is not just with people who are 20 and had a car accident. This is with people in their 90s. So you could have talked about it, right? But it's just hard. You're like, I'll do it next week. I'll do it next week. I'll do it next week. And then it's 10 years. So it's really important part of caregiving, but the thing I want you to see is that you got to be filled up as a caregiver in order to do it, and that's why making sure that you take care of yourself is so, so important. And then the other thing that I think should be a driver for all of us is avoiding regret, because that is the hardest thing to see in a family member, is regret, because there's no do-overs, right? There's no do-overs. And so often in the hospital, I would see family members go, oh my gosh, I should have had this conversation. I should have told him that I loved him. We should have gone on that trip that we put off forever. I should have asked her what she wanted. I should have. And here's the thing. So people think practicing palliative care must be depressing. It is the opposite of depressing. It's like the best therapy in the whole wide world, because it is a reminder over and over again that all we're guaranteed, any of us, is today. And we should not put off happiness today for some theoretical happiness in the future. Maybe we get a lot of time and maybe we don't. None of us know, right? None of us know. So learning from that to really engage in enjoying your life right now is so crucially important. And so if there's something you need to say to somebody, say it. Because not saying it and losing the opportunity and having regret is heartbreaking and it's unnecessary. So we should, whatever we need to do today to feel filled up, to be connected to people, whatever we need to say to somebody, we should say it today, because what we have for sure is what? Today. That's what we have for sure. And not even the whole day. Maybe like, we got probably for sure, probably a half hour. Who knows? We don't know. Right now, we have right now. That we know for sure. Right now. So based on all of the things that I learned from taking care of families in these situations and trying to make sense of it for myself, but also so I could teach other people, I've put it together in a roadmap. And the reason I call it, and the reason I call the book Courageous, is because it does take courage to bring open eyes and an open heart to these tough situations. It takes courage. It's not easy. But courage is awesome. You know, we have it. We all have it. But it's not easy, and that's okay. So I think that we show up and we say, gosh, this is hard, and I have mixed feelings about it, and I'm not sure I'm doing a great job, but I'm going to do my best, and I'm going to bring my whole heart to it, and I'm going to learn, I'm going to communicate with the family. That's being courageous. And that is way better than sticking your head in the sand and going, la, 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 just take more medicine. You with me on that part? So here's the steps that I think we all should take to be courageous caregivers, and they are, we have to have some knowledge about managing the medical machine, because the medical machine is insane. Have you experienced this? Right, as a patient, or if you're a healthcare provider, it's insane from both directions. And even if you're a healthcare provider, you either have been a patient or you will be a patient at some point. So the medical machine is a little nutty. So in the first case that we talked about, part of her suffering was just because she didn't know the difference between delirium and dementia, and neither did her student doctor. So showing up in an educated way where you advocate for yourself is pretty important. So managing, learning skills, how do I get the best care from this insane medical system is really important. That one's mostly about knowledge. We have to have skills to deal with the tough stuff, because this stuff is hard, and just hiding our head in the sand does not make it better. We have to have skills for making high-quality, tough decisions, because sometimes there's tough decisions to make, right? Should I get that second round of chemo that the doctor said might help, might not? Should I change hospitals? Should I move my parent into a facility even though we said we weren't going to do that? There's tons and tons of decisions, and how on earth do you thoughtfully and with skill make tough decisions when we've most of the time never had to do it until we're in the situation where we have to do it? There's a lot of emotions, and they're fine, but we need some skills to manage our strong emotions, both about our loved one and about ourselves, about our own mortality, about if we feel guilty about how it's going, are we good enough, are we messing it up, what about are we still being a good parent or spouse or sibling? So there's a lot of emotions tied up when someone in the family is ill or declining. And then super important, super, super, super important is filling up our own emotional, physical, spiritual cup, because if you're depleted, hard things are harder, period. So part of dealing with hard things is filling up your own tank, your own cup, Because if you're empty, medium hard becomes horrifically hard. All right, so how do we do these things? So managing the medical machine, I think these are the most important steps. One is to educate yourself. And you just have to be thoughtful about how you educate yourself, because the internet is a scary place, right? The internet is a scary place. And here's the thing that's important to know. If you just start Googling X disease, you're going to find the mess of stuff, right? The reason, not only is it, yeah, maybe that person who has their website who talks about their disease and their illness, maybe they're not a doctor, true, but also when things go well, do you spend time going and posting about it on the internet? No, right? So if you look up a medicine, my doctor prescribed X medicine, and you Google that medicine and you just look at stuff people say, not doctors, not scientists, but stuff people say, the people who took the medicine and felt great and went golfing, are they posting about how terrible the medicine was or how good it was? No, because they're golfing, right? Who's posting about that medicine? Right, the dissatisfied people who had bad side effects. So it's not a representative sample of how people who took that medicine did. That's part of why it's so important not to just look up Joe's website on X disease or treatment. What you want to find are official websites of either national organizations, so the American Association of whatever your thing is, that's probably a safe place to find information. Or the American Academy of, that's a good place to find information. But be really careful not to take information and believe it from just some person's website who has a thought about the illness or treatment that you are facing. And I hate, this is key. I hate to say it, but boy, do you need to advocate for yourself in the healthcare system. Has anyone experienced this? Yeah, right? So if you have a loved one in the hospital, if you can, you should be there. Because here's what happens sometimes. The nurse comes in and you think to yourself, I haven't seen a blue pill before. So what should you do? Say something. What is that blue pill? Wait, we didn't have a blue pill yesterday, and the doctor didn't say they were starting new medicine. And if the nurse says, oh, it's fine, what should you do? Nope. Wait a minute. What? Well, hang on. What is that blue pill for? Oh, I'm not sure the doctor ordered it. Please don't stop. Please go ask the doctor if that pill is for my loved one. Because what might be happening? Wrong room. Might be for the guy next door. I hate to say it. It's my own healthcare system, but it happens all the time. The statistics for how many people are hurt by medical errors will curl your hair, right? So it's fine if you're annoying. Like when it's all done, you can send a gift basket to the nurse's station. That's what I recommend. Be annoying and then send a gift basket. So you got to be willing to stand up and say, I don't know what why that's happening. Wait a minute, that's not what they said. What test are they taking them to? They didn't tell me there was a test. Always ask, always ask, always ask. Even if someone's like, no, don't worry about it, don't stop, right? So the first patient we talked about, when the person said, your loved one has dementia, and she's like, that doesn't seem right. She could say, that doesn't seem right. Can you please explain to me, because last week he was doing the crossword puzzle, how he could possibly have dementia today? Are you a senior doctor? Because you look very young. Can I speak to the senior doctor on the team, please? Because if that had happened, the senior doctor would be like, oh, no. Obviously he doesn't have dementia, he has delirium because he broke his leg and we put him on all this morphine, and it is probably going to go away once we wean down the medicine. Would you like us to wean it down a little bit now and see if he can tolerate the pain and maybe he gets more alert? That would have been the right thing to have happen. All right, so you're all prepared to be annoying? You can say, Dr. C told me it's okay if I'm annoying. Okay, and then you do need to create a strong team. We're talking here about managing the medical machine, right? You got to create a strong team. And so what does that mean? That means the doctors who are caring about the disease, so the oncologist, the neurologist, the cardiologist. If you have a thing on your chart, there's a doctor in charge of that thing, obviously you need that person. But you also need people to help with function, because if we help your cancer, but you've been in bed, Your loved one's been in bed for a month and now they can't walk anymore because nobody bothered to have physical therapy and occupational therapy come every day and get them up. The oncologist could say, yay, we fixed their cancer, but now they're bedbound, right? So just remember, there's the disease, important, but then there's the human, the person. Make sure that you ask, you can be annoying, right? Make sure you ask, hey, I noticed that he's been in the hospital for a week and no one's gotten him up. Can we do something about that? Because that feels to me like that's not going to be good if he stays in bed for another week. What can we do about that? And this is what might happen. The doctor might say something like, well, I guess we could consult PT, physical therapy, and you say, yeah, let's do that. Anybody else we could consult with? OT, occupational therapy, yeah, let's do that. Let's just get all the things that are about function. That's what you want. And even if you have a loved one who had been feeding themselves before and now in the hospital they're just feeding them, maybe you want to say, hey, can we get occupational therapy to work, and can she still feed herself or not? Function, function, function. We're not, as doctors, taught to think about function, which is insane. But most doctors are taught to think about disease and not so much about function. But function is what makes us human and what makes us enjoy our life, right? So you may have to be the one who says, I'm really thinking about function and I want you to tell me all the things I can have that can help my loved one function better. Same thing with symptoms. Sometimes, I hate to say it, but in medicine we're like, well, they're nauseous. Here's a medicine. Gave them a nausea medicine. Okay, but it's not working. They're still nauseous. So if they're still nauseous, you say, hey, they're still nauseous. And then someone might say, yeah, but they're on Zofran. Okay, but it's not working because they're still nauseous. So like, what else can we do? Push, 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 because the doctor may be thinking, yeah, but I'm treating their infection, and that's what really matters. Yes, it really matters. It does. And their symptoms also matter. So if they haven't pooped, you would be amazed how many days you can go in the hospital not pooping and nobody notices. Crucially important. So by the way, constipation can cause delirium. So if you go 6 days, 5 days without having a bowel movement and you're in the hospital and suddenly your loved one starts getting confused, that could be just constipation. And we have stuff for that. We can make you poop. That's one thing. We can always make you poop. But only if somebody notices that you haven't pooped. Right? So make sure that you're noticing what the symptoms are and that you're bugging the medical team to help manage them. And then well-being in general. Is your loved one feeling really stressed out? Are they anxious? Are they depressed? We undertreat depression all the time, particularly in older people. Depression can cause confusion, change in cognitive function. So sometimes people are like, well, he has dementia. Okay, but he also doesn't want to do anything anymore, and it kind of happened like over the last 3 or 4 weeks. Isn't that kind of quick for dementia? And, you know, he just lost his beloved brother, and his best friend just died. You know, maybe he's depressed. Maybe it's not just dementia. So think about well-being through your lens of you know this person and ask the healthcare providers, what can we do for that? I feel like he's really anxious. I feel like he's really depressed. What can we do about that? And then it might spur them to bring somebody else on board to help. So that's creating your team. So how do we deal with the tough stuff? That's number 2. This idea of bringing your wholehearted self with your eyes open to the situation, I think is so important. So many times I have had family members say things like, don't tell her what she has, or no, we don't talk about that, or no, you have to stay positive. No. Closing their eyes to the reality of what's happening. And I get it, it's hard. Nobody wants to be in a situation where you have a thing that your doctor says, I'm sorry to tell you, but the truth is sometimes we have those things. We do. And it isn't better to hide from it. It's better to look at it, to talk about it, to bring your wholehearted self to it. And once you do that, sometimes you can put it to the side. So here's the image that I use that I find helpful for myself. So if you're thinking of something you're afraid of, like I don't want to talk about that cancer, I don't want to talk about that illness, and you think about that as fear, you're like, holding the door, keeping him behind the door, can't let him in, we can't talk about it, we can't think about it, we're holding the door closed so that that idea doesn't come in. Well, if you're holding that door closed, you can't go to lunch, you can't play cards with your loved one. All your energy is there keeping that guy, that fear out. Whereas, If you just let fear in and you say, he's yucky, he's a little smelly, I don't love him, but he's sitting on the couch, I'm going to go have lunch with my loved one. We're going to go make cookies. We're going to play cards. We're going to go for a walk. He's there. I know he's there. Every now and again, I got to look at him. But I'm not going to spend my whole day, all my energy, trying to keep him locked away, because it robs us of the joy of life. So that's what I mean by keeping your eyes open and your heart open. Just be like, yep, here we are. It's an advanced illness. I wish it weren't true, but let's do the things we have to do. We've got great doctors. We're going to go to that appointment next week. But you know what? Right now, let's go paint something together, because we used to like to do that before. So again, we're holding space for two things. You can acknowledge there's a serious illness or decline, and you can enjoy your day. Both things can be true. The second bullet is so, so, so important. This is really important. If you remember only one thing, probably this is the most important thing for you to remember. It is not yours to fix. It is not yours to fix. It is not yours to fix. Here's a bunch of things that are not yours to fix. There are others. You can't fix your loved one's feelings. You can't fix their disease. You can't make them happy. You can't fix if they want to eat or not. You can't fix if they can sleep. You can support, you can show up, you can be there, you can learn to manage the medical machine, you can call the doctors, but you cannot fix it. It is not yours to fix. And a lot of our angst and stress comes from this feeling that we have to fix the unfixable thing. It is not yours to fix. You are walking beside your loved one on a journey, but it is not, you can't make the mountain smaller, right? You're walking up the path together. You cannot make the mountain smaller, but what you can do is walk beside them up the mountain. It's not yours to fix. 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 You get it? Here are things that are yours to be in charge of. So the energy that you bring to your loved one, you're in charge of that. So if you show up cranky, exhausted because you didn't set any boundaries, you're not getting any help, you're trying to fix all the unfixable things, and you're just like, ugh, what? You can control that, because that makes kind of for a yucky day. So you can control your own energy. You can control how you treat your loved one. You can control, most importantly, how you treat yourself. Are all of you experts at treating yourself with total love and care and support? No, me neither, but it's a goal, and we should work on it. We shouldn't forget to put that on the list. How we treat ourselves is as important as how we treat our loved one. Notice the messages you say to yourself. You'll be horrified at how mean you are. Seriously, like, oh my God, you messed it up again. Gee, what are you doing? You would never talk to someone that you love that way. Right? Notice the messages that you give to yourself, and treat yourself the way you would treat someone that you really love. And of course, we can control if we sleep, if we eat well, if we move, all of those things that help our energy, help fill us up so that we feel better. This is my favorite picture. Okay, so what is in the person's mind? Blah, 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 everything, junk, blah, 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 mess, things that happened before, things that could happen, things they messed up, blah, blah, blah. And what's in the dog's mind? Yeah, now. What's happening? It's not nothing. The dog's not blank. The dog is just like, ooh, trees and sun. That's what I got right now, trees and sun. So this is like a master class in improving well-being, honestly. Because here's the thing. Our minds can only be in one of three places at the same time. It can be in the past, which is often ruminating about things that went wrong. Like, oh, why did I do that? Or why did he say that? Or why didn't they invite me? Or I should have stopped smoking sooner? Or, things that are gone. Can you fix them? No, done. So does ruminating on them help you in any way? No. So it could be in the future, which is often, oh my God, what if this happens? What if that happens? What if the scan is bad? What if mom falls? What if in the future? If you're not doing anything to fix it right now, does ruminating about it, worrying about it help anything? No, it just makes you crazy. but right this literal moment that you're living in. So we all are in this moment right now, like I'm here talking, you're listening, hopefully we're all here together. It's not so bad right now, right? We all have things we could worry about, but we're not starving to death, no one's trying to kill us right now, we're not way too hot or way too cold, whatever, it's fine right now. So the more we can remind ourselves to notice where our mind is, bring it back to whatever's happening right now. Like, right now, I'm not doing this right now, but you can imagine, I'm slicing the peppers, I smell the garlic, I hear the sizzling, I feel the knife in my hand. That's the now when you're cooking, right? So if you go, yeah, but what if that happens? No, take a deep breath. Right now, I feel the heft of the knife, I smell the garlic, I hear the sizzle, I see the red peppers, that's my now. And the more we do that, the less anxiety we have. Truly, for real. This is really life-changing. So this is one of the things, remember I said in the beginning, what do the families do who are doing well versus the families who are falling apart? They did this naturally. But you can teach people to do this, and it really, really, really makes a difference. Okay, so how do we make good decisions? We have to be able to talk about hard things. We have to be able to ask the right questions. And this sounds cuckoo, but I'm going to tell you in a minute why this really works. Imagining the future worst and looking back really is a good, helpful tool. So we got to talk about hard things, which we talked about before. We're going to go at it with open eyes. So the kinds of things that you really want to ask, if this is a like, what treatment should we decide with the doctor kind of situation, literally what is happening, and what is most important to me. So yes, I could do more chemo, but they said that it's going to reduce my quality of life significantly and only going to give me another 2 weeks of life. Is that what's most important to me? Maybe it is, but maybe it isn't. And asking the right questions is incredibly important. Don't just assume that because the doctor said, here's what we're going to do, that necessarily that's the right thing for you or for your family member. Ask, what are the benefits we expect to get from that and how likely? What are the bad things that could happen and how likely? And doctors hate this question, except I always liked it, and I think you should ask it anyway, even though they'll tell you not to. I really think it is not a bad question to say, what would you do? If this was your mom, if this was your dad, I know your mom and dad are different than mine, I understand you're not telling me what to do, but I just want to know your thought process. What would you do? And it doesn't mean you have to do that, but I think you get some information. If you say, what would you do, and they tell you, and then you say, why, you get kind of inside their real mind and not just their doctor face, you know? And I think you can get some good information from that. And this is a little crazy, but I actually find it very helpful for people who are stuck with a decision. They just do not know what to do. And when you know, like, should we give the medicine that has a potential side effect, or should we not? Which one of these feels better? Going to the worst case scenario, so we gave the medicine and a bad thing happened, how does that feel? Or we didn't give the medicine and a bad thing happened, how does that feel? And sometimes that can give you an insight into something like, well, I feel like if I did the best we could, I would, even if it didn't go well, I would feel like I had done the right thing. Or you might say, you know what, first do no harm, so I would rather do nothing than do something that's going to have a side effect. So sometimes this trick in your mind can help you figure out what you want to do now. So handling strong emotions. We all have a judge in our head that is mean, that says, you messed that up, you're not good enough, that other person would have done that better, no wonder they don't like you because you did that thing. We all have that judge. And he or she is not helpful at all, right? Not helpful to us. So recognizing those messages that we have that are harsh for us helps us not generate worse emotions, stronger, more painful emotions than we have to. We also want tools for calming down our nervous system and something called positive reframing, which I'll show you in a second. So the other saboteurs, this is based on the work of Shirzad Chamine, Positive Intelligence is his book. It's very powerful work. These are the saboteurs that we have. Generally, one or two of these saboteurs are most prominent in us. Like some people are super controlling, some people are sticklers, they have to have something perfect all the time. Some people feel kind of like victims, some people are pleasers, they want to please all the other people all the time. All of this generates more angst in us than we need. And so learning to get control of this, manage our own feelings, can help turn down the emotional temperature. This is another one of the things that families who are coping better tend to do on their own. It is one of the things that I help people with. So how can we calm our nervous system? This is really important because when we're ramped up and agitated, our nervous system changes, our pulse goes up, our blood pressure goes up, our muscle tension goes up, and everything feels worse. So we have this amazing tool with us, which is our breath. When we breathe in this one particular way, it increases our relaxation response, turns down the stress response. And this is the key thing. An exhale longer than the inhale. So everybody's numbers are different. Like I can't say breathe in for 4, breathe out for 7. Those are my numbers, but yours might be different. But the idea is count in your head when you breathe in. You can do it right now. Count. So for me, it's 4. Yours might be different. And when we breathe out, just add a couple. Just that. Do that 10 times. You have changed the way your nervous system is functioning. You've stimulated what's called the parasympathetic nervous system. That's the relaxation response. Changes the way your nervous system works. So a longer exhale than inhale. That's a tool you have in your back pocket all the time because breathing, hopefully, is always with us. There's all kinds of other things that you can do if you like them. You can do meditation, you can do guided imagery, you can do Tai Chi or yoga. There's no one right way, but what matters is this idea of turning down the stress response, but the breathing technique we just did is probably the easiest thing to do. If you like apps and listening to things, these are some apps. I have no connection to any of these apps. Insight Timer is free. The others have a little bit of a cost, but this is a great way to calm your nervous system. You can put it on your phone or on the computer or on an iPad and just listen to a recording for 5 or 10 minutes a couple times a week. Makes a huge difference in calming your nervous system. This is the easiest meditation in the world if you like this sort of thing. Here's what you do. When you breathe in, you think 1. When you breathe out, you think breathe. Breathe in, you think 2. Breathe out, you think breathe. Do it for 3, 4, do it to 10. Do this once or twice a day. It's such a simple exercise. Anybody can do it, and it decreases your stress response, which decreases the difficult emotions that we all have when we're going through tough stuff. And this is probably my favorite tool. I want you to remember this one, and I really want you to practice this at least once today. This one is great. This is the idea. I don't like, or I hate if you want that word, I don't like blank, but at least blank. So, I don't like, I'm making it up, that it's raining outside, but at least I have a garage. I don't like that I have to get chemotherapy, but at least I have great doctors. I don't like that I have to do radiation, but at least they said I won't lose my hair. And they don't even have to be connected. I don't like that I can't play golf anymore, but at least my dog is adorable. They don't have to be connected. What this does, so this allows you, remember we said holding space for 2 things at once. This allows you to hold space for the yucky stuff. So we're not saying everything's great, yay, because it's not. Sometimes it's bad. It's holding space for the I really don't like or I hate. But then it turns your head a little bit to the side, but at least something more positive or joyful. And the more you do this, the better you get at it. And the times you do it are when you complain, like, oh, I can't believe that they don't have my sandwich. But at least I have the money to buy lunch and I'm not hungry. Or at least I'm with you, my best friend, and we're going to spend time together. Or at least they have really good coffee. Right? You get it? This is key. Your homework is to practice this at least once today, and ideally several times every day for the rest of your life. Simple homework. And lastly, filling up your cup. When we get depleted, everything is harder. So for me, this is a wonderful exercise. I do it for myself. I did it for patients all the time. Here's the idea. You draw yourself a cup, you write on the top things that fill up your cup, either things you currently do or you used to do or you could do, including getting enough sleep, reading a book, hanging out with my friends, playing with my dog, playing golf, going for a walk, all the things. And then you put on the bottom the things that empty your cup. Worrying too much, fighting with my sister, staying up too late, eating junk food, all the things you can think of. And then circle 2 on the top and 2 on the bottom that you're going to work on. So that gives you 4 ways, small ways, to start little by little working on filling up your cup. And when you've done those, then circle 2 more. But to go from I'm totally depleted to, I'm doing yoga for 2 hours a day, forget it, that's not happening. But these are little steps that can get you moving in the right direction. And then lastly, you got to keep track of the fullness of your cup, because if you wait until you're totally depleted, it's so much harder. So if you start to notice, gosh, my neck hurts more, my headaches are coming back, feeling more tired, that means, oh, you know what, my cup is probably a little bit empty. Let me go back, let me do this exercise again. Let me add a couple things I'm going to do to fill my cup. Try to do fewer of these 2 things that empty my cup. Let's see if I can get the level back up again so that hard things are not quite as hard. And that's it. Thank you so much for your attention.
Wow, whoa. Wow, that was amazing, Dr. Chiaramonte. Wasn't that good? That was great. Now, number one of my goals in being involved in this event is that you at least walk away today with one good idea or something that is going to help you or your loved one. Did we get a few good ideas there? Okay. So now I'm going to up that goal that today when you leave, you walk away with 10 good ideas. You probably got 10 out of that program, but we got lunch, we got afternoon programming as well. A couple of things that I want you all to remember is that you can get Dr. Chiaramonte's book. I know you've got a busy day. Are you going to hang out for a little bit?
I can stay for a little bit.
Okay. So we can hang out for a little bit here, and out of curiosity, does anybody have like a burning question that, for Dr. Chiaramonte? Let's do one.
I don't know how important it is to everybody, but it has, all right, I'll ask it.
Yeah, let's do
Sorry,
that.
I'm embarrassed. Hi. I recently got a new doctor about 8 months ago. For some reason, I won't get into it. They've given me some medication that was supposed to help me. I went to visit my sister and my niece, and it was a very busy day, and my sister said that my niece said, "That's not Auntie Kathy." My sister says, "That's not Auntie Kathy. You don't act like yourself." I tried to get information. What am I doing? What is it? And they said you kept repeating and you were something. I was drinking a ton of coffee. Not only that, I had 2 great granddaughters, great nieces I had not met, that wanted everything from me, to act like a bear, to be a horse, to be everything. So I was all over the place. I'm afraid to tell my doctor that I don't want him to change the medication and take something else. I'm afraid of medication, and he's got me on this that I was afraid to take. I don't know what to do.
That's a great question.
I love that question.
That's a
Thank you.
great question. And so I'll distill that down, because I think probably everybody has had this experience, which is something happened in the healthcare system that doesn't feel quite right, and I'm afraid to say something about it. Has anyone else had that experience? Yeah, lots of people. So the first thing that I would say is write down for yourself, so your thoughts are clear, exactly what happened and what you'd like the doctor to know. Because part of the challenge in the healthcare system right now is that visits are unfortunately short. So you want to make sure that you start out the visit being clear about what you want to talk about. So that's one, is write down, get your thoughts together so you know what you want to say. And then, I think I'm going to say, I really want you to talk to your doctor. But you can start by saying, I feel uncomfortable bringing this up, but. And that preps them for, okay, now they're really listening. What? Why? Why do you feel uncomfortable? And so I feel uncomfortable bringing this up, and tell them why. Because I'm afraid you're going to stop this medicine, and then maybe we'll start another medicine, and I don't really like medicines, but I want to tell you the truth about what's happening for me so that we can work together so that I can feel as good as possible. So absolutely say that. And if your doctor is a jerk and says, I don't care, then what should she do? Yeah, get a new doctor, right? There's plenty of doctors who would be really grateful that you said that. And the most important thing, though, I think, is start out the visit that way. You know what a door handle question is? As you're leaving. Right, so you're afraid to bring up a thing. And so you're like, no, I'm good, and my cough is better, and my blood pressure's fine. And then as the doctor's like, okay, they're closing the visit in their mind. They put their hand on the door handle, and the person now brings up the thing they're scared. Well, actually, there's one more thing. If you do that, you get less time. Your doctors now, they were already in their mind in the next room. So you want to start the visit with that. There's something I really want to talk to you about. I have some concerns. I'm afraid to bring it up to you for X reason, but this is what I want to focus our visit on today. Would that be okay?
Man, great question and great response. And something that I didn't know about until recently is there's a whole new section of pharmacists, and they're called de-prescribing pharmacists. So they went through school to train how to give us drugs, and there's a new breed of pharmacists that are figuring out, okay, how can I take you off drugs so that you still have the appropriate outcome?
Wait, I have to tell you one funny thing about that. So I've been a hospice doctor in the past too. Sometimes when someone comes to hospice and we say, okay, like let's take away a lot of your medicines that you're not going to need anymore, you know what sometimes happens? They get better, yeah.
Okay, we're going to just do 2, and then we're going to go up the stairs to lunch, okay?
Your lecture was wonderful, but my question is, this was fantastic to educate all of us here. Do you have any specific symposium to deliver this kind of alertness about the situation, which is a major issue in medical industry? Like, anybody who gets diagnosed for cancer automatically becomes depressed. So depression is a part of one of the bad type of diagnosis like cancer. So my question is, if you have a patient like that, do you jump in antidepressant, and how do you approach those kind of patients, which are many of them? How do you approach that depression, which I'm a physician, I'm antidepressant drug?
So many important things in that question. Thank you for raising that. So in the book, there's a whole chapter on the difference between sadness and depression. So just because you're sad doesn't mean you're depressed. And every person who's sad most certainly does not need an antidepressant. But there are many mind-body tools, exercise, including plenty of other acupuncture, evidence-supported tools that can help people who have mild depression, and certainly plenty of things to help people who are sad. How do we get this out? Honestly, it's literally why I changed my career path. So I was just practicing regular palliative care before. I've started the Integrated Palliative Institute. I have a podcast, Integrated Palliative Podcast. I wrote this book so that people who don't have a ton of money to work with me privately can have access to what I know for not too much money, because I feel like we all need to be talking about this, and we're not. So I'm just like put a box, I'm standing on it, and here I am talking. So help me spread the word. I'm happy to speak to your groups. You should teach everybody what you learned so that we all spread the word.
Okay, we'll do one question, and then we're going to keep the dialogue going upstairs during lunch and after lunch. But here's one last question for Dr. Chiaramonte.
Yeah, hi, this is actually an observation and a suggestion. My father-in-law was very ill about 25 years ago, dying, post-stroke, dementia, the whole 9 yards. And we were in Florida, and he kept sitting there saying pain and falling asleep in his lunch. And my sister-in-law said, well, we need to do this, we need to do that. He needs a feeding tube. And the daughter-in-law, who shouldn't be speaking at all, said, no. And my sister-in-law looked at me, and she said, what right do you have? And I looked at my mother-in-law, I said, now this guy was a CEO of Hess Shoes. He was a prominent, brilliant man. I said, if Dad had had a crystal ball, and that was the end. And that's a good thing to think about. What would they, if you never discussed it, what do you think they would say in this position where you're in bedridden, you need to be, you can't poop on your own, nothing. And my mother-in-law just said, we're done. And he was dead 2 weeks later.
So that is
wonderful.
I'm sorry for your loss.
No, it was a
still.
good thing. It was just,
But that concept is tremendously important. If you are ever the healthcare agent, meaning you're speaking for another person, we the medical system, are not asking what you think. What you think and what you want, forgive me if I sound rude, is irrelevant. Your job is to tell us what you think they would have said. So I always ask in just that way, if they could wake up right now for a minute and tell me what they wanted, you know them better than anybody, what would they say? And that's what you're to tell me to do, even if it goes against what you personally want. And so on the one hand, that might sound harsh. On the other hand, it's a release, because it's not you deciding. You're just telling the medical system what you know about what that person would say if they could magically wake up for a second. And the related thing to that, I think, is medical doctors, we can always do something to you. We got stuff, right? We have stuff, but it may not help you. It may even hurt you. Don't assume that more aggressive medical care necessarily is in anybody's best interest. Sometimes it is, sometimes it isn't, though, and that's really what you want to ask. What's the benefit we would likely get out of this? And if it's not a benefit that that person would care about, then it's maybe not the approach. We're not like being aggressive or giving up. We're giving aggressive care, either medically focused care if it's helpful, or symptom focused care if the medically focused care can no longer stop the disease. But we're always being aggressive. It just may be aggressive symptom focused care to improve somebody's quality of life. Thank you guys so much.
All right. Okay, folks, thank you, Dr. Chiaramonte. Books here. Food is upstairs. We'll be back here at 1:15, but make sure if you've got questions, comments, ideas, grab me so that I can make sure that we address it in the afternoon panel.
And for those of you who aren't lunching with us, please feel free to continue to talk to the vendors that are at their tables, because that will go on while we're eating lunch as well.